My name is Dr. Bopoto and I would like to discuss cervical cancer. Cervical cancer is a malignant condition that arises from the cervix in a woman, and the cervix is the opening to the uterus. In a way of context, in 2020, up to 600,000 new cases of cervical cancer were diagnosed, and of those, up to 320,000 women died. One woman dies of cervical cancer every 2 minutes the world over. The commonest risk factors for cervical cancer include multiple sexual partners, or a partner whose partner has got multiple sexual partners, early sexual debut, as well as other lifestyle factors such as smoking and obesity. In addition, cervical cancer is increased in people whose immune system is depressed or deficient, as may occur in somebody with poorly controlled HIV infection. Early detection, like in any other cancer, saves lives. Cervical cancer is one of those cancers that is easily preventable by screening. Screening allows us to detect abnormalities before they become cancerous. And these abnormalities can then be treated and eliminate the risk of developing cervical cancer. Therefore, early detection of the precancerous lesions, as well as early detection of the cancer before it spreads, give us the best chance of cure. Cervical cancer is not one disease. There are several types. The commonest type is the squamous cell carcinoma, which in the majority of cases is associated or caused by the human papillomavirus or HPV. The second commonest is the adenocarcinoma, which also in the majority of cases is associated with HPV. There are other less common types of cervical cancer that we diagnose quite regularly in our environment. The first one we've already talked about, and that is screening and early detection. Public health education on what risk factors are and on how to reduce them is also helpful. Now, WHO is recommending that girls from the age of 9 to 14 be vaccinated against the common types of HPV, and this is perhaps going to be the most important intervention in terms of preventing cervical cancer. As healthcare practitioners, we recommend that every person who is eligible gets screened, every person who is eligible gets vaccinated, and every person who is eligible gets the appropriate treatment.